$340,000. That's the bill a family received after one medical emergency. They didn't ask for expensive treatment. They didn't choose an exclusive hospital. They just got sick. And one illness cost them everything. Her name was Rebecca. She was 44 years old. A project manager at a tech company. Decent job. $85,000 per year. Her husband, Mark, worked in manufacturing. $72,000 per year. Together, they made $157,000. Above average. Comfortable middle class. They had health insurance. The standard employer-provided plan. They thought they were covered. Employer health insurance in 2015, deductible $2,500, out-of-pocket maximum $12,500 per year. Rebecca and Mark had 2 children. They owned a home worth $450,000 with a $280,000 mortgage. They had $85,000 saved for emergencies and retirement. They had done what you're supposed to do. Worked hard. Saved. Prepared. They thought they were ready for anything. They were not. Rebecca had a heart attack at work at age 44. No warning signs. No family history of heart disease. No risk factors her doctors had identified. One afternoon, her heart simply stopped working properly. She was taken to the nearest trauma hospital. The emergency department stabilized her. She underwent an emergency angiogram to check for blockages. They found one. Stent placement. 3 stents implanted. 5 days in the hospital. Cardiac intensive care. Medications. Monitoring. Tests. Emergency cardiac care in America, one night in intensive care costs $6,000 to $10,000. 5 nights, $30,000 to $50,000. Rebecca survived. The doctors saved her life. She was grateful. She had no idea what was coming. 3 weeks after discharge, Rebecca received the first bill. Hospital bill from the trauma center, $187,000 for 5 days of hospitalization. Rebecca opened it and thought there must be a mistake. $187,000 for a hospital stay? She called the hospital. They said the bill was correct. The charge breakdown showed, room $8,000 per night, emergency services $42,000, angiogram $35,000, stent placement $65,000, medications $18,000, lab work $19,000. Rebecca called her insurance company. She asked what they would cover. Insurance covered 80% of the hospital bill, but only after Rebecca met her $12,500 out-of-pocket maximum. So Rebecca owed $12,500, out-of-pocket maximum, plus 20% of anything beyond that. Hospital bill, $187,000. Insurance pays 80% of $174,500, after deductible, equals $139,600. Rebecca owes $47,400. But the hospital bill was only the beginning. Rebecca received separate bills from doctors who treated her. The cardiologist, $15,000. The anesthesiologist, $8,000. The radiologist, $6,000. Lab fees, $12,000. Imaging facilities, $18,000. Total from specialists and ancillary services, $59,000. Rebecca's insurance had a separate out-of-pocket maximum for ancillary services. She had to pay $12,500 again. Plus 20% of the rest. Specialist bills, $59,000. Insurance pays 80% equals $47,200. Rebecca owes $11,800. Then came the follow-up care. Rebecca needed cardiac rehabilitation. 24 supervised exercise sessions. Physical therapy. Psychological counseling, recovering from the trauma of a heart attack. Cardiac rehabilitation program, $18,000. Insurance covered part of it. Rebecca owed $6,200. Medications. Rebecca needed 4 new medications. Blood thinners. Beta blockers. ACE inhibitors. Statins. These medications are expensive. Her insurance didn't cover them fully. She paid $150 per month out of pocket. 1 year of medications, $1,800 not covered by insurance. By the time all the bills were processed, Rebecca's total medical costs from one heart attack were: hospital, $47,400. Specialists, $11,800. Rehab, $6,200. Medications, $1,800. Total, $67,200. But wait. There's more. The hospital also charged an facility fee. Emergency room has its own billing code. The trauma center markup. Administrative fees. Additional, processing and administrative fees from various providers, $18,300. Rebecca's actual total out-of-pocket cost from one medical emergency: $85,500 in the first year of recovery. But the story doesn't end there. Rebecca's insurance company appealed some of the hospital charges. They said some fees were not medically necessary or not pre-authorized. The hospital appealed back. It took 18 months to fully resolve the billing disputes. Total time in billing resolution, 18 months. Total amount disputed, $23,000. When it was all done, Rebecca's actual, final out-of-pocket cost was $108,400 for one medical emergency. Rebecca and Mark had $85,000 saved. The medical bill consumed $85,000 of it. They had zero emergency fund left. They couldn't pay down their mortgage. They couldn't save for their children's college. They couldn't invest for retirement. For 3 years, they worked just to rebuild the savings they lost. Rebecca's career also suffered. She returned to work after 2 months, but she couldn't work full intensity for 6 months. No promotions that year. No raises. Mark took on extra shifts to cover the gap. He worked 60 hours a week for 2 years. Loss of income during recovery and reduced earnings. By 2018, 2 years after the heart attack, Rebecca and Mark had spent or lost $136,400. $136,400 loss to one medical emergency for a family that did everything right and had insurance. Rebecca recovered medically. Her heart is stable. Her doctors say she should live a normal lifespan. But financially, the damage is permanent. She lost her emergency fund. She lost years of retirement savings. Her children's college funds were never started. She and Mark are now 5 to 7 years behind on retirement savings. Retirement impact: at current savings rates, Rebecca and Mark will retire 5 to 7 years later than planned. Lost retirement income: $400,000 to $500,000 over their lifetimes. In other developed countries, this doesn't happen. In Canada, Rebecca would have paid $0 for her emergency care. In Germany, she would have paid a small copay and nothing more. In Britain, she would have paid $0. But in America, she paid $108,000 for the privilege of not dying. U.S. healthcare costs: $4.5 trillion per year for 330 million people equals $13,600 per person. Germany, $6,700 per person. Both have similar health outcomes. America's healthcare system is unique. It's built to extract maximum profit from sick people. Hospitals charge 3 to 5 times what they accept from insurance. Rebecca's $187,000 hospital bill is based on inflated list prices that nobody actually pays. except uninsured people. The facility fee Rebecca paid is pure profit. It's not tied to actual costs. It's just extracted. Hospital profit margins, 3 to 4%. But hospital CEO salaries, $1 to $3 million per year. CFO salaries, $500,000 to $1 million. Administrative overhead, 25 to 35% of revenue. America's for-profit healthcare system transformed medicine into an industry. And industries extract maximum value. Medical debt is the leading cause of personal bankruptcy in America. 66.5% of all bankruptcies are tied to medical issues. Rebecca and Mark did everything right. They had insurance. They worked hard. They saved. And one medical emergency still nearly destroyed them. How to protect yourself from medical bankruptcy. 4 critical moves. 1. Understand your insurance before you get sick. Read your insurance documents. Know your deductible, out-of-pocket maximum, what's covered, what requires pre-authorization. Call your insurance company with specific questions. Don't wait until you're in an ambulance to learn your coverage. 2. Build a medical emergency fund separate from regular savings. Most people's emergency funds are $3,000 to $5,000. That won't cover one serious illness. You need $15,000 to $20,000 specifically for medical emergencies. This is not optional if you live in America. 3. When bills arrive, request an itemized statement and negotiate. Medical bills are often wrong or inflated. Request an itemized breakdown of every charge. If anything seems expensive, call and ask why. Hospitals often reduce bills if you ask and demonstrate financial hardship. 30 to 40% of bills can be negotiated down. 4. Appeal denials and fight billing disputes. Insurance companies deny 1 in 7 claims. If your claim is denied, appeal immediately. Get a patient advocate, hospital has them, free. Appeal again. 40% of denials are overturned on appeal. Don't accept the first no. I'm grateful to be alive. The doctors saved my life. But I'm angry that I have to choose between health and financial ruin. In America, those shouldn't be mutually exclusive. But they are. So protect yourself. Know your insurance. Build medical savings. And never, ever accept a medical bill at face value.